Not everyone that comes into counseling or therapy has big issues. Sometimes, of course, there are instances where people may have big issues, like for instance, dealing with past trauma or traumatic experience or childhood trauma. And really those seem to be, for some people, bigger issues that we talk about, and in those instances it's really just about helping them process their experiences and to find meaning in their experiences and their struggles. And I think a lot of the times we can achieve catharsis and things like that, which is kind of like a relief or release of emotion when we just like talk about things, and so just talking about them can help us process them. So that might be one example of a big issue that someone might come in with, but it can also be little issues too. It can be like, everyday routines or relationship struggles or struggles with emotions or struggles with moods such as anxiety or depression. And so those are all little issues that people may come in with. And then there are times when some people come into counseling with no issues at all, really. They're kind of taking a more proactive approach, or they want to work on personal growth and development, or they want to develop and work on new techniques or strategies or coping mechanisms for when things do get harder. And so, like I mentioned, it's more of a proactive approach. So there's no one set thing that you have to come into counseling with. It's like you can pretty much come in for whatever you want and talk about whatever you want in here, and it's really, like I mentioned before, just about having that safe space to be able to talk about whatever you need to talk about.